I'm Vijay Aldandi. I'm an infectious disease clinician specializing in transplant infectious diseases, but also in public health. And one of the things that I care most passionately about is One Health anchored in social justice. This presentation is one of a series of concepts that I will use to introduce to you the concept of One Health. So to continue with our talk about salutogenesis. Salutogenesis requires a sense of coherence, which has three components: comprehension, capacity, and capability. So in this session, let's talk about comprehension. Comprehension really is the ability of anybody to understand exactly what is the current health condition, or any condition for that matter. Now, typically, we healthcare professionals are very fond of using a lot of jargon, trying to tell our patients, well, you have this infection with HIV and it is causing AIDS, and therefore you need treatment. And I have to check your viral load, and we need to know your CD4 count. We've got to wait and think a minute about, does that really make sense to the person that we are engaging with? The reality is, for anybody to understand something that they are encountering, it must harmonize with a mental image that they already have. Which means that I, as a healthcare professional, must ensure that whatever I am trying to communicate is something that is easily understood because it harmonizes or it resonates with a pre-existing mental image. And if there is no pre-existing mental image, then we have to think about how one can create something that will be easily understood by the other side. One way of ensuring this is to simply ask the individual to repeat back in their own words what they have understood. Now, this is a technique that very often is used in communication, and it is termed a simple repeat back. No doubt you've seen examples of it in the airline industry when the pilot is approaching the airfield and communicating with the tower. The pilot will say, "Coming in at 30,000 feet, check." And the tower replies back, "You are coming in at 30,000 feet, check." And the pilot says, "Check." So this way, we are all very clear that what is understood is what has been said, and what is said is really understood. Therefore, it becomes absolutely imperative for us to first take the trouble to have a very clear understanding of exactly where the individual is coming from that we are trying to work with. It is best to enter into a dialogue, a partnership, rather than have a transactional relationship where the healthcare provider is the benefactor and the healthcare consumer is the beneficiary. It does not work. The better way to look at it is that this is really truly a partnership. In a partnership, there must be a shared vision, a shared understanding. Once we are absolutely certain that both of us are on exactly the same page, then the probability of comprehension goes up. So the next time you are thinking about communication with the person that you are trying to help, think a little bit about how you can craft a communication that is clearly understood by all of the parties involved. Comprehension sometimes requires the cooperation of many other people that the individual trusts. Think about it. If your own friend that you knew for many years told you that there is something that's going to taste delicious, you are likely to try it because you trust your friend. You know your friend for many years. And if he says, this is a delicious new dish, try it, you might be willing to try it. Whereas if a complete stranger told you, try this, it's delicious, you may think twice before trying it. Maybe it's trying to give you something that is really bad, will not taste good, or maybe even dangerous. It is the same with the healthcare beneficiary. To ensure comprehension, to ensure the shared vision, we must take the trouble to build a partnership, a relationship of trust. Thank you.